Hello and welcome to Docplexus News. The Union Health Ministry has proposed to appoint private and overseas doctors for teaching at government and private medical colleges. This decision was taken to overcome the shortage of teachers and faculty in medical colleges. The MCI says that the appointed teachers would be working on a part-time basis as visiting faculty. This new regulation will be applicable to all colleges except AIIMS, PJMER Chandigarh and JIPMER Puducherry. In a bid to hike the current OPD treatment charges in various strata of healthcare centres, the Uttarakhand state government's mandate of increasing the OPD and other treatment prices was implemented across the state from January 1, 2020. The IPD rates in government hospitals will now be Rs 45 per day as opposed to Rs 40 per day earlier. A regular private ward will now cost Rs 200 per day and an AC room will cost Rs 600 per day. Additionally, the OPD registration will now cost Rs 25 and the indoor fees for various wards will be hiked up to 10%. It was also reported that a hike in treatment charges has been made after a gap of 9 years. The US FDA has approved Ubrogepant tablets for the acute management of migraine with or without aura in adults. It is not advisable as the preventive treatment of migraine. It is the first drug in the class of oral CGRPR antagonists to be approved for this treatment. The effectiveness of the drug was studied based on the positive results from 2 randomized placebo-controlled trials with 1,439 adult patients who demonstrated early remission with Ubrogepant. Scientists have recently developed a new tumor DNA platform which will identify colorectal cancer patients. This platform also helps in predicting disease severity and survival chances. The method analyzes the circulating tumor DNA or ctDNA and can also be used for screening at an early stage of the disease. Furthermore, the model was based on 9 different methylation markers associated with colorectal cancer, which helped this model to distinguish colorectal cancer patients from healthy individuals. The International Research Consortium has developed a CKD risk equation that identifies high accuracy individuals at a risk of developing CKD in 5 years. The tool is based on the data taken from more than 5 million patients around the world. The risk calculator's working is based on the use of variables including age, hypertension and diabetes status. A team of doctors at a Bangalore hospital performed a novel robotic liver transplant on a 40-year-old patient suffering from chronic liver failure. A portion of the 32-year-old donor's liver was extracted using a robotic arm, which resulted in a small scar in the bikini area but not over the abdomen. The extraction was done with the assistance of a 360-degree view camera, which was placed inside the donor's abdomen, and the accurately positioned robotic arm. The recipient has now recovered from the surgery and is performing normal duties without any issues. The use of a robotic arm and minimal scar formation on the donor's surgical site have made this surgery unique. Researchers from Australia and the United States have recently discovered a new autoimmune condition characterized by episodes of fever and swelling of the lymph nodes. The research was provoked after members of 3 different families presented with these symptoms, reporting the first occurrence during their childhood. A DNA exome sequencing in these individuals revealed a common mutation in the RIPK1 gene that encodes RIPK1 protein for regulating programmed cell death. This condition is named as cleavage-resistant RIPK1-induced inflammatory syndrome. The year 2019 saw several major changes and reforms in the healthcare industry. Before stepping into the new year, let us take a look at the major healthcare events of the past year. Starting with the first major event, the Health Ministry initiated the process of converting 75 hospitals in the underserved districts to medical colleges, which boosted the number of MBBS seats. Secondly, the Ayushman Bharat program received a whopping 1.5 lakh registrations from healthcare centers and catered to 69 lakh beneficiaries. A bill was proposed by the Maharashtra government proposing the reservation of 10% MBBS and 20% medical postgraduate seats for those willing to work in rural areas for 5 to 7 years. However, the said bill was stayed with the establishment of the new government. The year 2019 witnessed the historic event of the 63-year-old Indian Medical Council Act being substituted with the National Medical Commission Act. The new act will replace the Medical Council of India with a new body aiming towards a more integrated, quality-oriented and cost-effective medical education. The year marked an end with the Health Services Personnel and Clinical Establishments Bill 2019 being proposed and subsequently held. We look forward to the Health Ministry's verdict on the bill and hope for better outcomes in the coming year. These were the latest happenings in the medical field brought to you by Docplexus, the global online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!